do that. All right. Hello, everyone. Good afternoon. This is the October 2021 Genetic Ambassador Call, and I am so excited to have you guys here today. We have quite a few things to talk about, quite a few things I would love your feedback on. So I'm going to go ahead and get started, and as people trickle in, we'll add them to our introductions. I always start off with our funding statement. We couldn't do this work without HRSA and the grant that they provide to us. So this is our funding statement. And whoops, I know we have a couple new faces on today. So just to orient you to who Mountain States is, we are one of the 7 regional genetics networks, and these are our 8 states. Every state in the United States belongs to a regional genetics network. So if you have friends or advocates in other states that you know, and they want to get involved in their regional genetics network, please reach out to me, and I can point you in the right direction so you can get their information, get information to them as well about their regional genetics network. This is just a brief agenda for today. We're going to do some introductions because we have some new faces. I want to give you guys a Genetics Summit overview of some of the speakers. We are just under 2 weeks away. I can't even believe it, for our Genetics Summit. Then I want to give a sneak peek of the Genetic Explainer videos. Some of you reviewed that between the last call and this call, but just for some of our new folks, I want to just talk about that real quick. And then we didn't get to do this in July, so I really want to dedicate some time today to brainstorming some future projects for this group. And then just give a plug for the Time for Genetics application we have open for pediatricians and family practice folks, because I know you all are so well connected with your own pediatricians, maybe for your own families, and might have some ideas there of some clinics that might want to take part in that. So with that, I'm going to switch it over to introductions. We always start our Genetic Ambassador calls with introductions because I really feel like this is a great time for everybody to get to know other people in our region, maybe make some connections through the chat, exchange information. But we always start off with a question. So the question I picked for today is, what is your favorite genetics resource that has either helped you and your family or that you have shared with others? So take a moment to think about that for a second. I'll go ahead and introduce myself. And if you don't have one, you don't have to answer the question, so don't feel any pressure. But I'll go ahead and answer this one, start it off. So I'm Kristy Wiese. I'm the projects manager for Mountain States. I began in this role as a parent looking for answers for my own child, and it's coming up on 10 years now that I made that call to Mountain States after finding them on a Google search, and have done different roles in the organization, and now this project manager role. And one of my favorite genetics resources is a new one, because this has been a long time coming, and we've talked about it for a long time in Mountain States. But it is this Red Flags for Genetics handout that just came out in May. And this is just a culmination of the work of this group. And I'm so very proud of it. And so I've gotten really positive feedback. And so every chance I get, I've been sharing it. And so I just wanted to share it here as well. If some of our new folks have not seen it, it is available on our website. And we do have printed copies. So if you are in need of printed copies, I do have some packs of 10s and 20s that I can pop in the mail to you. If you're interested, just send me an email. This is what they look like. They're kind of glossy, and they have like rounded corners, and it's like on cardstock. So that's one of my favorite genetic resources. And the reason being is that I've been getting feedback from families saying, thank you for giving me something that I can now use to talk to my pediatrician, because they weren't hearing me before. Like, I was telling them I was worried about these things, and I was asking about genetics, but by putting this in front of them and showing them my child has a lot of different red flags in a lot of different categories, they're finally starting to understand me. So that, to me, that's huge. That was the whole purpose of doing this, was to help families communicate or identify things in their own children that might be things that they want to look into for genetics. So with that, I'll just go, if you guys don't mind, I'll call on you just on my list here. Gina, you're at the top of my list, not to put you on the spot, because this is your first Genetic Ambassador call, but please introduce yourself if you feel comfortable.
Yeah, so my name is Gina Zozaya. I actually live in Henderson, Nevada, which is part of Las Vegas. I actually have had twins that were born with PDH, genetics disease, mitochondriac. And my resource actually was through Fast Track, which is a Nevada state program. And I actually had children that had been I have been dealing with this. My kids were born in 91 and trying to find anybody that could help. I actually found resources through a doctor named Dr. Buse that lived in Portland. And then he connected me with Dr. Stackpole, which is in Florida. But throughout the years, trying to deal with it and trying to find resources and things that can help me, I learned a lot in the last going to be 30 years. Unfortunately, I lost one of my twins. It'll be 2 years on Saturday.
Oh
And so through this, now I want to give. So now I'm trying to, I'm actually the parent side that has gone through so much and found resources. And so that's been one of my goals, to get involved. And that's why I'm here, is to help out as much as possible on the parent side of it.
Well, we are so glad you're here. You are in good company. Everyone here is on that parent side. So we thank you for wanting to pay it forward. And I'm so sorry that you're coming up on the anniversary of your loss. But I thank you for sharing. What is Fast Track? I'm not familiar with that.
So Fast Track was a program that the state of Nevada had here, and it was ran through our University Medical Center. And it was like a portable unit that was doing genetic testing.
Wow.
Unfortunately, don't have it anymore. Now it's ran through Nevada State programs.
Early intervention.
Yeah, early intervention programs. And that's actually how I got involved with you guys. My dietitian, Shirley, who I've been dealing with for so many years. It's been wonderful. Referred me. But that was a program that the state of Nevada used to have. And without that, I mean, it was only because a doctor referred me and says, okay. But it was the same thing of questioning, what is wrong with my child? And no one was like, oh no, prematurity. I'm like, no, I have an older one. What could be wrong? No one. I'm telling you, it took me like almost total, I want to say my kids were like 18 months by the time we finally diagnosed it. Mm-hmm. And unfortunately, they had a lot of damage done in between because of the formulas and things that they were giving me. So yeah,
thank you for sharing about that. I had not heard of Fast Track, and that sounds unbelievable for 30 years ago. I mean, unbelievable that existed.
It was like a portable trailer in the back of the hospital, UMC Medical Center.
Thanks for sharing. All right, next I have on my list Danielle, and Danielle's also new to our Genetic Ambassador call. Do you feel comfortable, Danielle, introducing yourself?
Sure, yes. My name's Danielle, and I live in Phoenix, Arizona. I literally just started this job as a family advisor for the Office of Children's Health in Arizona. And I also volunteer with the Sickle Cell Foundation of Arizona here. Our son has hemoglobin SC. Both my husband and I carry a trait. So there's just so much about sickle cell that I still don't know about, but I'm learning. So it's nice to meet everyone. I don't think I have that question that you have on here.
No worries. It's not required. I have a resource for you though. So we'll play. Okay. How about I give you a resource, because I want to connect you with that sickle cell group I know here in Pittsburgh.
Oh yeah, I would love that. I mean, we see a hematologist here in Arizona at Phoenix Children's Hospital, Dr. Shaw, and he's been amazing with us. So I do love him very much. He's been with our son since he's been 3 months old.
Wonderful.
So now 3. So
we're so glad you're here. Thanks for joining us today, and welcome to not only your new job but Mountain States as well.
Thank you.
Yeah. Next I have Winton. Winton, do you want to introduce yourself?
Sure. Hi, everyone. Winton Wood. I'm first and foremost the parent of my 15-year-old, our 15-year-old who has Down syndrome and autism and is medically complex. And then I also work for the University of New Mexico, our Center for Development and Disability. It's an AUCB, and I always forget what that stands for, Kristy, but
University Center on Disability, is that right?
The AUC.
Jen, help us out.
the Associated, let's see, AUCD, that's the Associated University Centers on Disability.
Okay, there you go. Thank you.
You're welcome. I work at a UCED, so, which
There
is the
you go.
University Center for Excellence
Okay.
in Developmental Disabilities.
Very good. Very good. Thank you.
Alphabet soup.
Yes. So I worked there as a family specialist and a MEVIA consultant and sports waiver coordinator, which is MEVIA is the self-directed developmental disabilities waiver. And I'm also, I also have the role of the family specialist, and I work kind of with family-centered care, person-centered care with our residents, our pediatric residents and third-year medical students at UNM. And then, I don't know, I just do a lot of different things.
And you're a LEND participant this
Oh, and
round?
I'm a LEND, I'm doing the two semesters of LEND as a LEND trainee this year. And then I mean, I'm a resource geek. I just can't help it. I love resources. So I kind of narrowed it down to 3, which is good for me because I could be here all day talking about resources. One of my favorites is the C Center for Down Syndrome at Children's Hospital, Colorado, and them in association with the Global Down Syndrome Foundation, which is also located there. They do lots of research on genetic research related to Down syndrome. Fascinating stuff coming out of there. And then I love, of course, Mountain States Regional Genetics Network's website. I do. I can't narrow it down to one thing like the red flags, just the whole website. And then I also love the Medical Home Portal website, which is not just genetics, but they have a lot about genetic conditions. It's a great resource for families. It's a great resource for healthcare professionals because we can't know everything, but you can always go there and look things up. And they not only give in-depth explanations about different conditions, but they also then give resources that you can print out and hand out to families. Families can look up themselves. It's just a great resource. So, and I'll stop talking.
That's awesome. No, those are all great ones. Thank you so much, Winton, for sharing all those. All right, next I have on my list, it looks like Melissa had to drop off, so I'll just read hers real quick. It says, sorry, I'm playing dueling meetings today and cannot stay. I'm the co-lead for Texas MSRGN team, and I have an adult son with Down syndrome, and I work at Texas Parent to Parent. So that was Melissa Fox from Texas. And then I have Jen next on my list, Jen Bana.
Hi there, I'm Jen Biana from Montana, and I have a 21-year-old daughter with Pitt-Hopkins syndrome, which is a rare, affects the 18th chromosome. And I also am the coordinator for our Montana Family to Family Health Information Center. And Winton, I'm also a LEND graduate, and I work at the University Center for Excellence in Developmental Disabilities. And my favorite genetic resource has to be our genetic hospital in Montana. We are so blessed to have a genetic hospital, and it took 12 years for my daughter to get diagnosed, but now there's been 2 other cases of Pitt-Hopkins syndrome in my state, and both times the hospital helped me get together with the families instead of being worried about HIPAA and all of those things, which is how it used to be. They were able to connect us. And so now I've gotten to meet those families and their little kids. And it makes me super happy to be able to do that. And so I think that would be my favorite resource. That's a Montana resource, so it doesn't help anybody else out at this point, but.
And that's Shodare Hospital, Children's Hospital, right? That you're referring to? Yeah.
Mm-hmm.
And you forgot one of your hats, Jen. You're also the genetic navigator for
I'm
Montana.
also genetic navigator. So, sorry, Kristy, because, depending on what call I'm on, there's different numbers of hats. So I'm also a genetic navigator.
I'm just kidding you.
No, that is important. And I actually really like, I guess another one of my favorite genetic resources is probably the genetic pop-ups. I think those are they have been so helpful for the people that we've done them for. And I really enjoy doing them.
So we might want to tell, because since we have 2 new folks on the call, we might want to give some background on what a genetic pop-up is. Do you want to tell them what they look like from your perspective?
Yeah, I can do that, even though this is Kristy's brainchild and she should be the one that gets to talk about how awesome.
Go ahead.
So the idea was to do a pop-up and talk about genetics. And so we were able to do one in person prior to COVID that we did with a group that is a parent support group. And so I got to lead that one. And it was, having been through the genetic diagnosis myself, it was really great to be able to talk to other families about how to get a referral for genetics. That was before the red flags, so we didn't have that to help us out. And what some of the basic genetic language is that you hear, and how important is that language. And then we did the next one virtually, and that one was slightly different, but we did the same thing, talking about some of the frequently asked questions, talking about the resources in our state. And we had, at the second one, it was people who worked in early intervention. So it was the family support specialists who were supporting the families that came to that one. And then some families came also, but the family support specialists were so thrilled to have that general introduction to how the testing works in Montana and to some of the genetics vocabulary.
Awesome. Yeah, they are fun, and we are in the works planning our next round, which will be around February 2022. So stay tuned for some more details about that. Thanks, Jen. Next, I have Hannah. Hannah, I know you have some guests today, so I don't know. Can you introduce yourself?
Yeah, I can. They're not quite here yet, so
okay, perfect. Go ahead.
I can talk quickly. Hi, everyone. I'm Hannah Barnhart. I guess let me answer the first question first, which is favorite genetics resource. I have to say that all of the genetics network throughout the country have been such a great resource. And it doesn't matter where part of the country you are, and I'm glad that they're all connected by the National Coordinating Center, because then if you're someone like me who's moved around actually throughout the country, then you have access to all of that, and they connect with each other and they refer to each other. So that's such a great resource. But I am in Las Vegas, Nevada. So hi, Gina. I'm sorry I missed you last week with the meeting. And I am the genetics navigator for Nevada, but my background is actually healthcare administration, and I was in Alaska managing the only pediatric genetics clinic up there, is where kind of my background is. So I'm excited to be here again to see what we have in store for the ambassadors program.
Awesome. Thanks for being here, Hannah. And I see that Elvira just joined, I think. Elvira, do you want to introduce yourself? If you can.
Hi, my name is
there.
Elvira Dennison. I'm currently at the clinic. I work with Novel Family Voices, and good to meet everyone.
Awesome. Do you have any genetic resources that are your favorite, or any favorite resources that you work with through? I think Navajo Family Voices is an amazing resource, just in amongst itself being an organization. So if you want to tell everybody a little bit about what that is, that would be great.
Navajo Family Voices is a resource for families have health care needs. We're working with families to get resources of the questions that they are asking, and at times families don't know where the resources to where to look, so they call me to look it up, and I give them their information. And right now we're providing information to families and the questions that they need. Then we're also posting up conferences, resources to attend certain webinars on our Facebook. We have Facebook, we have an email list, and then we started off with a YouTube with our, so that's what's going on right now.
You're all good now.
Gotcha. Thank you. Thanks so much, Elvira. Yeah, they have a great website as well, NavajoFamilyVoices.org, I think. So, all right. Did I get everyone? Did anyone else join? I think we got all the introductions done. there. And thank you for everyone for sharing. I think it's great to hear what other people have found as resources, and just hear what other people are doing in our region. So I'm going to skip ahead to the next agenda item, which is the Genetics Summit. It seems like we've been planning this for a long time. We have probably since May of earlier this year, but it is just around the corner. It is coming up on November 9th and 10th. I know some of you have heard about this ad nauseum, so I won't belabor it, other than to say it is free and it is open to all families. It's open to all genetic professionals. It's really open to anyone who has an interest in this topic. Because it's virtual this year, you don't have to live in our region to attend. And so my first plea is to ask all of you to help us with one last push for registration. Last I checked, we had just clipped over to 400 registrants. And I have a goal in my mind that, wow, could we make it to 500 before the November 9th? So I would love for you guys to share it. Listservs, I have all the information on our website with even blurbs you can just cut and paste. So if you can't find that, it's called promotional toolkit on our Genetic Summit page. But if you need any of that information or graphics, just reach out to me and I'll happily cut and paste a blurb for you in an email that you can send out on your social media, your listservs, whoever you think might be interested. The theme this year is connecting the dots, and the way we came up with this dots theme is we wanted to have 4 different tracks. Some of you have attended the genetic summits in the past, and some of the feedback we have gotten over the years is that sometimes the talks get just too technical. They're just too sciencey, maybe too over our heads with jargon and technical speak. And so we wanted to try to bring some balance to that this year. And so these are the 4 tracks. We will have a disease and diagnosis talk, so that might be a little techie. It might be a little bit sciencey. But when we're also going to have an outreach track, so that's the O in DOT. The D is disease and diagnosis. The O is outreach, and that's outreach to community providers like pediatricians and family providers, because we know that's an area that is needed in our region as well. The T in DOTS is for total value. These talks will talk about things like from a financial perspective or cost savings or value propositions, if you will. And then the last but not least is the part that I was really lobbying for, to say, there's a lot of social and psychosocial aspects that go around genetics, and we really need to talk about them. We don't really talk about those in the past, so let's talk about those things. So the S is for social perspectives. So what I did today, just as a little teaser, I have 4 slides here, and I have all of the speakers. So I just wanted to highlight these for you really quickly. I feel like I've been living and breathing this, but forget sometimes that everybody else might not know exactly who's talking unless they've studied the agenda like I have. So on the first day, which will be November 9th, these are the 3 speakers that will be kicking us off in the D category for disease and diagnosis. Brendan Lee is from Baylor College of Medicine. He's actually the chairman of the department there, and he's going to be talking about gene therapy, giving a history of the history of gene therapy, the current state, and looking towards the future. Dr. Andy Rohrwasser is the director of the Utah Public Health Labs, and he's going to be talking about the future of newborn screening. And then Dr. Francisco Moreno is from Arizona, and he runs a program called All of Us. I don't know if everybody's heard of that program, but it's a national initiative to sequence, I think it's 1 million genomes is I think the goal. But he runs the program that's specific in Arizona, and talking about personalized medicine and reaching diverse populations with this program. So that's the D category. On that same day, on November 9th, the first day of the summit, we're going to have the O category, which is outreach, again, to pediatricians, family care providers. Tara Wanger is from Seattle Children's Hospital. She's a geneticist there, and she is going to talk about practical pearls for pediatricians and pediatrics around genetic testing and next generation genetic medicine. I heard her talk at another event and thought her talk was really, really applicable for primary care providers. So we invited her. The next talk, I'm actually so honored to be able to be talking with a geneticist that we worked with our own family, Dr. Stephen Kaler. He's from the University of Kentucky. He has a specific interest in autism and the genetics and metabolics behind autism. And so he and I are going to be doing a joint presentation talking about autism as a systemic condition. And beyond the MCHAT, if you're familiar with the MCHAT, it's a screener that's used for in pediatric clinics for to make a diagnosis of autism. So I'm excited to be doing that talk with him, and we were just practicing today, so have to keep practicing for the next week or so to make sure we get it all stuffed into 30 minutes. The next talk I'm really excited about. I wish Melissa was still on here, but this request for this talk came from our Texas team, because they have been talking a lot about delivering diagnosis with hope, and how the way a genetic diagnosis is delivered can really change a family's trajectory based on the language that's used, based on what's said. And so they had specifically requested, hey, could we have somebody at the Genetic Summit that will talk about this topic? And so we searched high and low, but found Layla and Donnie had published on this topic. And so she's from Utah. And so she's going to be talking about her research and some of the things that she's found. She's a genetic counselor. And so she's going to be talking about delivering a difficult diagnosis with hope. Next round, these will be on the second day of the talk. So the T and S will be on Wednesday. Make sure and mark these down for Wednesday. But for the first talk of Wednesday's sessions are going to be Ms. Vijal Trivedi, and she has written a book called Breath from Salt, and it's the story of cystic fibrosis. And it is an amazing book. I actually read it in the spring, and it basically takes cystic fibrosis from the very beginning of when it was published in the literature all the way through to drug development and treatments now for cystic fibrosis. And so she's going to be talking about that. She doesn't have cystic fibrosis. She's not impacted by cystic fibrosis, but she is a scientific writer, and so she chronicled this history, and so she's going to be talking about it from that perspective. Next, we have Dr. Abe Elias from Shodair Children's Hospital, so up in Jen's neck of the woods, her favorite genetic resource there. He is a geneticist there, and he's going to be talking about adding value to pharmacogenetics. So if you're not aware of that word, pharmacogenetics is talking about the way our bodies and our genes interact with pharmaceutical drugs or applications. And so they are working on a program at Shodair around pharmacogenetics, and he's going to be sharing some of that. And then last but not least here, we have Kirsten Bennett, who's part of our she's actually co-lead of our New Mexico State team, and she does a lot of work with telehealth and telenutrition. She's a nutritionist, and so she's going to be talking about the use of telehealth and community-based nutrition services for children. And then the last letter is S, social perspectives. And this again will be on the 10th on Wednesday. And these last three talks, the first one is by Dr. Tony Iton. He actually comes from California, and I heard his talk last year and thought, wow, this is really, really interesting. But the title of this talk is When It Comes to Your Health, Does Your Zip Code Matter More Than Your Genetic Code? And it has a lot to do with the social determinants of health and what impact those have on health and health disparities. Then next we have Renee Begaye. She is a researcher from Colorado, and she is going to be talking about ethical genomic research with Indigenous communities. I got a chance to meet with her and talk with her a couple of weeks ago, and was really, really interested in all the things that she's working on. So I can't wait to hear about her, or I can't wait to hear her talk. And then also from Colorado, we have Mariah Gillespie. She is a member of the Colorado State team, and she's also a genetic ambassador. And she's going to be talking about living ultra rare, navigating diagnosis and next steps from her own experience with her own 2 children in Colorado. And I got to talk with Mariah as well and got a sneak peek of her talk, and it's really jam-packed, Winton. You'll be interested with resources. So she's got lots of resources for families that are, you know, when they tell you, well, there's only 50 other cases of this in the literature, or there's only 100 cases of this, ultra rare conditions where somebody might not even know the name of it, you know, recognize the name of it because it's really just named for the gene that they found. So anyway, that is a sneak peek of all of our speakers. Over the last 2 or 3 weeks, we've been sharing these on Facebook and social media. So if there's a particular talk that you're really interested in and you want to share it with somebody you know on social media, all of them are up on Facebook, and we have a couple more to post on Twitter this week. So that's where you can go for these graphics to be easily shared if there's somebody you want to pass those along to. And the agenda, of course, is online as well if you want to look at that. All right, with that, I'm going to stop sharing here for a second because I want to switch my tab here. All right, so we met last in July, and in July, we didn't get to this, and so I sent it out via email, and some people got a chance to look at it and provide feedback. I know Jen sent me some feedback, but since not everyone got to see it, then I wanted to play this. So Mountain States is working on something called explainer videos, and these are videos that we hope to put out 2 a year for the next couple of years that will help families explain to themselves and explain to their friends, loved ones, community members, schools, genetic concepts. So this is the intro to those explainer videos. The first one that is in the works right now is on the term variants of unknown significance, or VUS. We did a survey back in the spring of all the genetics professionals that answered our survey and asked them, what are the words that you're constantly redefining in clinic? Like, what are the high usage words that families need to know, or that you're constantly redefining in clinic, so that we still want you to define them, we still want you to have that conversation, but what can we provide for you to provide to the family that they can take home with them? What's a link that they can look at home when all the dust is settled, when they had a chance to exhale and go, what was that term again? I don't remember what that term was, and have time to digest it. So what I'm going to show you now is just the intro for it. As I said, I forgot to share my sound, so let me just click that button there. This is just the intro for it. Just keep that in mind. This will be at the beginning of every single one of these videos. So I'm just going to play it, and would love your feedback at the end. So let me see if this will work. Can you hear it? Going to see a genetics professional can come with many emotions. Anticipation of finding answers that may help your child feel better, a feeling of fear of what lies ahead and what your child's future might look like, and perhaps a feeling of being overwhelmed as you process all the new information and new words that you hear during the visit. This video and others in this series are aimed at helping you, your family, and your support system understand all of this new information and new vocabulary that you may hear from the geneticist, genetic counselor, or other medical professionals when speaking about genetics. All right, so that's it. Let me stop sharing there. Jen, do you want to tell them your suggestion? I haven't made it yet, but I think it's a great one. I have it written down, but wanted to gather this feedback from today before I go and make edits.
So I think I had a couple, but I don't know that I remember.
You remember? One of them that I had written down was at the very end when the thought bubbles come up with the geneticist. It was to put some words in the thought bubbles, like some genetic words. Yes,
that's the one I remember. I did because I thought that's what this is about. So again, it repeats kind of what's happening at that beginning with some of those words, because like variants of unusual significance is one of my favorites to do at the pop-ups.
And maybe I'll do de novo in honor of you too.
I know. So yeah, de novo is another one of my favorites. And in case people haven't experienced that word, that came up on a lot of my daughter's things and I didn't know what it meant. And really all it means is that whatever the chromosomal change is, it happened in utero to that baby. It didn't come from mom or dad. It's not inherited, but it sounds so smart to be like, you know, my child's genetic condition is de novo. And it's easy to say. And for some reason, it's almost like touche to the genetic people that use all these big words. I'm like, I know this word, de novo.
I love that. All right, so that's a great suggestion. I think that's at the end there when it has all the people. I can easily put some words in there.
Speaking
Oops.
about genetics.
Sorry, I was gonna pause it here on this and show the screen. I think this is what you're talking about. This one right here at the end where they all have the little thought bubbles.
Yeah, that was because
Yeah.
I'm like, because it seems like that's what they would be thinking about. Like, here's the word I'm going to tell this family. And it's
Yeah.
like, what, you know,
Right.
it could be a great place to preview what some of the other ones are going to be about.
Preview some of the other ones, yeah, for sure. Great suggestion. Anybody else? Again, this is just the intro to it. All of them, we wanted to create an intro so that all of them would have the same starting part, and then we would go into the word or the concept. But we wanted to create a consistent introduction, and so that's why we started with this first, because this will go in the beginning of every single one. Any other feedback? Good, bad? It was too fast, too slow? Hannah's got a little happy party icon.
I want to see too, Mama.
I hear somebody little or little
I
bit.
know, sorry, that's my little granddaughter. I'm like trying to get her out, but I was gonna say it. This is all new to me, but so I actually really enjoyed it.
Oh, good.
Since I'm coming in, I'm new. I truly enjoyed it. That's the only reason I took my screen off, because I ended up having my granddaughter jump into my office.
No worries. Hi, sweetie.
Hi.
Good. So you thought it was okay?
Yeah.
So again, just the intro, and the next one, the one we're working on right now, is going to go into variants of unknown significant, and it's based on a handout that we have already on our website with cat and rat, like the misspelling of cat and rat and how genes can get misspelled, so to speak. So that's kind of the concept we're going with on that one. Anyone else? If not, I'll switch back over. All right, well, I'm gonna make Jen's edits. I saw Winton shaking her head whenever Jen suggested that. So if you guys think putting those words in will be a good addition, and then I think I'll finalize it and get it out to our team and get our approvals so that I can tack it on to the other part. You guys will be the first to preview our others as well. I'll probably be by email once I get the variant of unknown significant finished, but would love your feedback as we go through this process to get them finalized. But my hope is not only will they be a resource on our website, but my hope is to push them to the clinics, so the clinics are actually using them firsthand with families as well, the genetics clinics specifically. All right, let me go back here and share my screen again and see what we've got up next. And let's see, that was the explainer videos. And then next, I wanted to do some brainstorming, which is perfect. We've got about 20 minutes left, so this will be a great time. And I'll leave it up here, and I'll actually type, if you guys don't mind, if I leave it in this format. But I wanted to brainstorm with this group about some project ideas, speaker ideas, or training ideas, because what comes out of this group are such great ideas, and I love when we can pick one thing and just kind of work on it. And that's how the red flags for genetics came to be. It was first an idea, well, let's ask people, what were their red flags? Let's make a survey for families. And that came out, and then we were able to take that survey data and put it into a printable format or a PDF format. So I really wanted to ask for your all's ideas on what is needed, what's needed out there for families. I'd like to keep it in that for families perspective, since that's what brings us all together here for Genetic Ambassadors. I've gotten a couple suggestions from some people, so I wanted to share those as well, but would love this just to be an open mic moment, if you will, of brainstorming, what are some things that are missing? Kind of like the red flags for genetics handout for families. What are some other things that are missing that you feel like when you're talking to families, or you feel like in your own journey, you really could have used, that we can all come together and brainstorm around and then figure out, okay, how do we make this happen? So I'll be quiet for a second, but I will type as people talk so we can capture ideas. So feel free just to unmute or put in the chat if you don't want to talk on mic right now. And just keep in mind that it has to be kind of something broad enough that we can use it for all genetic conditions and not just a specific genetic condition.
This is Winton.
Yeah, go ahead.
Something along the lines of the caregiver burnout, and it can even be at the very beginning when you're starting to suspect that something is going on before you get a diagnosis. You know, we think of burnout as later, like years of being exhausted and sleepless nights, but there is that beginner's caregiver burnout because you are taking in so much and the learning curve is so steep. And then you're wondering what you did wrong, right? What can you do? Are you doing enough? So some kind of a tool. I know there's tons of tools out there, but it's never enough. And some kind of a tool that's reassuring. So not just like, oh, here's yoga poses to do, or meditations, or mindfulness, or, you know, here are some things that you can use like scented candles, something that's more like reassuring that, you know, it's not you. And, you know, we're here, we're all here to hold your hands, to comfort you. You know, just.
I think it's an amazing idea. I have a question. Do you think this exists? Have you seen anything for the genetics realm? I know there's a ton out there, but like, have you seen anything specific to genetics caregivers of the individuals with genetic conditions?
I have not. I have seen in general for, you know, those caring for their elderly parents, those caring for their children who have disabilities or medical conditions. I've seen it all, but there's nothing about the beginning burnout. It's a different thing. We think of burnout as over the years. We think of it as a timeline and further down. I'm talking about the very beginning, like the day that you figure something's, that the beginning of that journey, that comfort and that reassurance and those tools start immediately, not later when you're already burned out.
I like that perspective. Yeah, I like that perspective. Almost, I don't know if you're familiar with this term, but D-Day, you know, with diagnosis day, like almost like a primer on, like, here's what, you just got dumped all this information after you're able to take a breath, like, here's what's next. Here's what you need for you.
Yeah, because you're being told everything that, you know, usually you're a parent. I kind of look at it that way. So usually you're being told about, okay, all the appointments you now have to make, whether it be with therapists, doctors, everything else, you may need, you know, medications or durable medical, who knows what you're needing, but you're needing all this stuff. And there's everything for your child, but there's nothing about you. And you just can't, you know, at that point, I think that you're probably blurry-eyed and there's probably guilt, you know, because even, you know, it's like this genetic thing, you know, you shouldn't have to have that feeling of guilt, but I think all parents do. I don't care no matter what. And it's all there.
Even if it's de novo?
Even if it's de novo, of course. As long as you're a parent, that's all you have to do is be a parent, or even a caregiver.
Right.
Be the biological parent, but there's still guilt there. So something that like is handed with the diagnosis. Here's your, you know, your reassurance and your, you know, your packet, whatever, you know, your
toolkit. Yeah. Great idea. Anyone else, or anyone want to jump on Winton's idea if you feel like that's needed?
Well, I feel like it's needed. I saw a great talk by that came out of Eddie, that was actually out of Utah, and it would be not this, but it was like the next step, because I agree, when I've been to all these self-care things and they basically give me a list of crap I cannot do. And then I just feel worse, like I can't even take care of myself. Like when they say, do a yoga, you know, and they're like, all you need to do is get out of the house. And I'm like, well, if I could have done that, I would have already done that. And so the Eddie one was really good about some of the things about thoughts and the way our brains work. And it was very simple, but it was like, oh yeah, like that's why I feel that way. Oh, here's a little thing I can do that would help with that, because now that I know why I'm feeling guilty or how my brain is processing that or why I feel fatigued, like, and so it was really helpful. And I can probably find that one. It's like it'd be like class 2 of this one. It'd be the next one. But we talked about too doing the funding stuff, like how to get things paid for, how to deal with denials, very specific to the genetic piece. And we also talked about how that relates to the early periodic screening, testing, and diagnosis, or whatever that EP.
DT, right?
Yeah, I got to get that on my wall somewhere so I won't forget, because I think that families aren't as familiar with that. And the other thing is, I don't think I've heard at any of our meetings, like how can the family-to-family health information centers help? Like, because there is one in every state and on some of the reservations. And so I think that's another thing. Like I was just sitting here thinking, like when Winton was talking and people have been talking about the resources they give families, like if you call the family-to-family center, if we don't know the resource, we find it for you. And I hope that's what's happening in other states. But so families can really lean on that. And then, that those centers then figure out, or they then learn what the barriers are and those kind of things, and they're able to help systemically.
Those are great ones. One other that I wanted to share that came from another family member on another team was, she said she was talking with a mom. They had gone to a genetics appointment and they had ordered a bunch of tests. And she's confident that they told her what the tests were in the moment, right? What they were going to be testing for. But when the mom got home, she didn't have anything that she took with her. Like there was a lab slip. They went to the lab, got it drawn, turned in the lab slip, and the mom didn't have anything. And so she said it made her realize and think, like, is there anything out there too that just generally, not a specific gene test, but generally might talk about what types of genetic testing there are and what they would be for. So maybe something like the chromosomal microarray, what is that testing? Maybe whole genome or whole exome sequencing, what is that testing for? Maybe a single gene panel, what is that testing for? I don't know. So is that something that you all see a need for or not?
This is Hannah. So that kind of depends on the training of the genetics counselor, because for the team that I worked with, and there's 2 genetic counselors that I work with, they always accompany the lab slip or the visit summary, for the visit itself, with a paperwork that says, okay, so this is what it talks about, the chromosomal microarray, or if they're doing WES. So there's always an accompanying document. So I'm surprised that family never got one, because they should have gotten one. But yeah, I mean, I feel that that's a need. If genetic counselors aren't doing that, then yeah, that's definitely a need.
Thanks for that perspective, Hannah. And yeah, again, not to single anybody out or not to say somebody's should be doing something they shouldn't, but it could, some of this I think gets lost in the translation, kind of even with the genetic words, right? Okay, there in the moment of the clinic, you're going to be explained what a variant of unknown significance is, but the chances of you understanding that when you get home after, you maybe have driven an hour and a half with a child who's missed their nap time and is screaming, right? Like, I remember those days when I was like, I get home and I'm like, oh, what was that? What was it I wanted to go look up and read more about? And the word's gone. So something that families can reference later too.
I think I think as time is going on, we are covering that more and more through our mobile apps, where you can access, like, I know that like the different healthcare systems that we use, Children's Hospital of Colorado, down here in Albuquerque, several of them, we get a handout when we leave. It's the printout, your medication. Right. They're doing it now automatically. You might not have all the notes that the specialist or the doctor that we saw today. Yeah, but we can go in a day later and it's in the portal. So I think that, I think that we need it more for everyone, not just genetics or parents. We need it for everyone in the healthcare system. We need to do a better job, but I think we are slowly getting there, and it's becoming, the training is happening with healthcare organizations. And the more that people are accessing their My Charts or, their mobile apps.
So here's a thought, Winton, to bounce off of that. So that's awesome. We'll be able to get, we can go find the after visit summary in the portal. But how about what is needed, or what could enhance that after visit summary, where it would be super easy for the clinic to embed a link and say, for more information, go to this resource. So how can maybe Mountain States and Genetic Ambassadors create something there that could be plugged into an after visit summary? Whether it be, you just received a diagnosis, here's the caregiver, here's what you need to know as a caregiver, right? And take you to the toolkit. Or here's part 2 about how your brain works and processes, and this webinar. I don't know. I'm just throwing those things out. Like, how can we enhance? It's awesome that it's getting in there, but how can we enhance the information then that's getting to parents of more, more resources for them?
Yeah, you could do that with your clinic, the clinics, the pilots. We can start that way.
Yeah.
Like, I know the Taos one, they do have a portal. That might be a way to start. I just find it shocking that that parent didn't get anything. I mean, I find it shocking. I think that that whoever she saw did a very, very bad job, and I don't think it's necessarily. I mean, obviously we have to do a better one, but I think I would hope that would be an exception to the rule. That I would think that she would have gotten a handout. I find it a little shocking.
Well, and it makes me think, Winton, that maybe what we need to do is empower families. So if, for example, that genetic counselor just didn't give them that piece of paper for whatever reason, giving families a guide of what kinds of questions to ask when they're at that appointment, and what kinds of resources we already know exist. Because I know sometimes that then prompts that good work that's already been done to be given back to the family, and then the family's ready to ask for it, and the doctor's like, oh yeah, or the genetic counselor, we have that, but for whatever reason it might not have made it into the room. So sometimes I find doing it in inverse, so that both people are working on it, makes it a lot more successful.
I kind of want to second Winton and Jen on that one, to say, to empower families. So one of the families that I worked with, who's actually a good friend of mine, just adopted a child. And so she had all these questions. And I said, oh, great, you have questions. Awesome. Let's write them down and let's put it in a binder or whatever you're comfortable with bringing to your appointments, so that when you get there, you're not trying to pull it out of thin air, because I guarantee you have a newly adopted child. They still have to adjust with your family situation, and you're not going to remember everything. So I second Jen on empowering families, and maybe that could be a training idea, to have a training session that families can attend, to say, hey, I should write down questions. I should have a binder or a notebook. That's what I suggested with her, because when we dealt with families that came to our appointments in Alaska, that was one of the things that the genetic counselors that I worked with, we actually started that. We started to empower the families to say, okay, this is your first appointment. We hope that you never have to come back to us. We give you a diagnosis, and then, we give you these tools and the follow-up appointments with other providers. But in the event that you do, here's a notebook that you can start writing down your questions. You're, bathing the dog and you remembered something, you write it down. So something like that, I think, would be great for families.
That's great. Great idea.
Some of the organizations that I had worked with, parents reaching out started. I mean, I think that this has been going around the country, and people have been borrowing the idea of the binder, but they hand it out to families for free. It stopped because it became costly. But with the tabs, birth certificate is here. Here's the log. Each time you contact someone, write it down for things like Medicaid or for waivers, because later on you're like, well, I called you. Well, we don't have a record of that. If you write these things down, because often with genetic conditions for children, they are eligible for a lot of different supports and programs. So the binder had those things, you know, vaccinations, doctor's visits, specialist visits, IEP for school. So the binders, they had the tabs pre-done. I think I have one or two. And it actually, you know, was really good for like my elderly father. Same thing, kind of, you know, VA appointments. What does that look like? What's your medication list? Who are all your specialists, their names and their numbers? So that if you do go out, there's, you know, whoever's there can refer to that binder very easily. But those binders are great, but they've been done. So there's no point in reinventing the wheel, but maybe we can take what's been done and then spread the word more.
And have you heard them being converted to apps? Because I know there's a couple projects that I've been pulled in on that have been trying to take the binder idea and make it mobile.
You can, it gets a little, in my brain, it gets a little sticky because you're dealing with such HIPAA, and there are, I mean, I've gotten from all the healthcare providers, hospitals, etc. Our whole family has gotten the letters, we've been hacked.
Mm-hmm.
You know, so it's, you know, when you have this binder, then you worry about fire.
Yeah.
You know, but I'm still a little wary of that because I don't think we're there yet in protecting birth certificate, social security card. I mean, these binders had all those things. This is where you store that stuff.
Yeah.
So
I understand. There's just been a couple. One was a care coordination app that won the HRSA challenge award called Care something. Anyway, Family Voices National did it with Boston Children's Hospital. I think it was more of a connecting different providers around the child. And anyway, but yeah, no, great ideas. I've got that down here. Thank you, Hannah and Winton, on that. We're coming up on our last minute, but go ahead. Somebody else had something to say?
I was just to say, Kristy, you could simplify it into a sheet that could be printed that was like your first genetics appointment. And then like, there's these lists of other things to bring, but it could just be simplified into one sheet with those list of things to bring. Here's some, you know, write down what you want to ask. And then here's some common questions that families ask. Because you could almost do it like the red flags where you surveyed families and found out what were the questions they had or wish they had asked. Because like, I was just thinking, I'm not sure I asked, how long will it take for this to get back? And like when I did it, you know, 10 years ago, it took 6 months. But I think, so that's one of the things, if you've done multiple tests, that it's like, when is someone going to call me? Who's going to call? And so I always leave forgetting what that was. And that's like the most important thing. When am I going to know?
Yep.
That's right. Like in a pamphlet form, you could have questions that you can ask, and then, you know, you turn the page and it's like lines where you can write your own questions, but like a cheat sheet for families because you're bleary-eyed. So it's great to have other people do those suggestions because they've been there. Like that, Jen, exactly. Like how long until the tests come back? You don't think, you think a week, 6 months later. So that's great. That's a great idea.
Yeah, no, I like that a lot. Awesome. All right, keep your ideas coming and share with me if you have any speaker ideas too. We had the speaker on our July call about the gene matcher, and I got some positive feedback that people liked having the speaker every once in a while too. So if there's some topics that you want me, I know I'm already on the hunt for EPSDT for Jen and my conversation. So if anybody else has any speaker ideas, please send them my way. And then I'm just going to switch over to 3 reminders I have because I don't want to keep people over their time. I already talked about Genetics Summit, but if you can help share the word, if you haven't registered yet, please do. You've met some of the genetic navigators on this call. All 8 of them are up and running. So I'll have the hyperlink here, but it's on our genetic navigator page on our website. And the very last thing I just wanted to put a plug in for, just because we still have lots of spots open for the Time for Genetics. Our deadline is coming up for November 15th. So for anyone that's new on the call, this is our group. This is the program where we are educating pediatricians, primary care providers, and family medicine practices about genetics. And we have 16 spots open for cohort 2. Which the application deadline, as I said, is November 15th. So if you know a pediatric provider, if you know a family medicine provider that you think might be interested, you can do one of 2 things. You can talk with them about it, or you can contact me and say, hey, I think they would be great. Would you mind, here's their contact information. Would you mind reaching out? And I'm happy to do that. We have the application and all the information at this T4 info site on our website. So any ideas on that, I'm open ears and happy to do the legwork. So just let me know. And with that, I'll just put my information up there. Yep, go ahead.
So I know, like in New Mexico, we have one that's established. We have another one that's coming on board. How many more slots do we have in New Mexico right now open?
So we have 16 spots across our region. So if another state doesn't recruit anybody, then other states can have those spots. In my opinion, ideally we have 2 spots per state, so 16 spots open. But some states have not submitted anyone yet. And so for those states, I mean, hopefully they will. I mean, I know we still have still 2 or 3 weeks away. But the more the merrier. And I think we can fit more in. We only have a handful of applications that have actually come through. So I'm just, and I'm still working on the New Mexico ones because we haven't seen the applications come through from New Mexico. I know Sandy's been busy outreaching to them, but we're still waiting for them to apply. And the application is not onerous. It's about 4 minutes. It's like their name, their email, their phone number, and why they're interested. It takes about 5 minutes to fill out. All right, with that, I will ask if there's any questions. I'll stick around for a few minutes, but I don't want to keep everybody too long if they have other meetings they have to jump onto. I see a chat. Nice to meet you, Danielle. Thanks for being here.
Hi, thank you.
Bye. Anybody else?
Gotta go, Kristy.
I can skip back if go ahead. Yeah, see you, Hannah. I can skip back if anybody else has any ideas. Thanks for the brainstorming. This is great. Thank you, Winton.
Bye. Thank you, everyone.
Bye-bye. See you later.
I'm actually having to go. I'll probably reach out to you in a little bit, Chris. I have some questions. I mean,
Yeah, no
everything
worries.
was over